For Filipino and other products from Asia, as well as fresh fruits and vegetables, poultry, meats, and seafood, come and visit 88 Supermarket with branches at 4801 Victoria Drive and its new location at 2611 East 49th Avenue in Vancouver.
Dollar Smart 99 cents App Store, located at 4811 Diesel Beach Way in Richmond. Telephone number 604-207-0072.
Philippine News Canada is brought to you by Rayford Media Group.
Hello mga kabayan! Narito na ang pinalawak at pinalakas na coverage ng Philippine News Canada, Balitang Vancouver Nationwide. Mga pangunahing balitang nakalap ng aming news team para sa linggong ito. Kasama ko ang aking very best friend, ang typewriter. Ako po si Rosette CORREA. At ito, ang Philippine News Canada, Balitang Vancouver.
Kumus tapo kayang lahat. Welcome and hello to everyone. I want to take this opportunity to say a special thank you to those in the Filipino community for their incredible work and contributions to Canada. I also want to acknowledge the courageous and compassionate Filipino workers who are daily putting their lives on the line in hospitals, emergency rooms, care homes, and other places by taking care of those who are ill, the elderly, and the most vulnerable. That compassion is so remarkable, and you've contributed so much to our country for years and continue to work tirelessly throughout this current COVID-19 pandemic crisis. Please know just how much you are appreciated. God bless you and your families, and thank you again. Salamat po.
Kakulangan ng racial and ethnic data sa COVID-19 hinihingi ng Pinoy Organization.
Right, to devote resources, medical, public health, in order to support those communities. We certainly do not want the data. We call on the data to be used ethically and responsibly, right?
Kulang ang datos tungkol sa COVID-19 na mula sa racial and ethnic sectors at inihingi ng grupong tulayan na tugunan ng BC Ministry of Health ang pagkalap ng datos na ito upang makasagot sa mga urgent needs ng Filipino community and those affected ng pandemic. Ayon kay Dr. John Paul Katunggal, isang assistant professor sa Social Justice Institute ng University of British Columbia, ang evidence-based public health decision ay hindi magiging posible kung wala nitong data na ito at maaaring lumala ang sitwasyon sa mga marginalized British Columbians. Sa isang virtual press conference, ipiniliwanag ni Dr. Katunggal at ni RJ Aquino ng Tulayan Filipino Diaspora Society ang kahalagahan ng pagkalap ng datos na ito, lalo na sa Filipino-Canadian community.
Of disproportionate vulnerabilities, incidences, or death rates. Right? As RJ said, other jurisdictions in North America have this data. Right? In jurisdictions like New York or Louisiana, they have noted a disproportionate impacts on people of color, including and especially Black and Latinx communities, Indigenous communities as well. And here we are coming from our embodied decisions as Filipino migrant and diasporic community members, where we know from our community that our members of our community are overrepresented in particular areas of work that have been rendered essential services, right? And so based on the stories that we know that are circulating in our communities, there are some forms of disproportionate vulnerability based on being in the front lines. Right? And so part of what we know from that, from these stories, right, is these kinds of disproportionate experience. And so we want to call on the BC government, the Ministry of Health, to collect these kinds of race and ethnicity data in order for us to be able to get a better picture of patterns, if they exist, of disproportionate vulnerabilities, incidences, or death rates. And we want to see this at different points in the public health system, in terms of rates of testing, in terms of hospitalization, and also in terms of post-recovery. We want to see how race and ethnicity factor as social determinants of health in these various stages of encountering the medical system. And ultimately, we want to support Dr. Bonnie Henry's and the Ministry of Health's already robust decision-making around policy and public health action. And this is another kind of layer of knowledge that would strengthen our capacity to make these kinds of decisions.
I'm ROSETTE CORREA. I am from Rayforth Media. I'm one of the ethnic media outlets in the Filipino community. So I'd like to thank you for putting this press conference together. I was listening to you about data collection. So one of the most difficult things perceivably in the Filipino community is really data collection. We did initially, there have been some associations and organizations who have asked help from the ethnic media community, the Filipino ethnic media community, to do research on certain areas. Like, for example, the Liver Foundation, the BC Liver Foundation already asked us to help them with data collection. And unfortunately, the data collection wasn't as successful as they as they wanted it to be, simply because it was very challenging to collect the data from the Filipino population, from the Filipino Canadian population. So my question, one of my questions is, how will you get the data? How will the data collection start? Where will it start? We have already a lot of Filipino families who have traveled to the Philippines within this 2-month period and have come from the Philippines, going out and coming back to Canada. And some of them have already been affected with the COVID virus. Yet these are, this is data that would be pertinent to what you are trying to do, yet there is no trace of where we can get this particular data. And we all know that a number of these families do have family members who work in the healthcare industry. And so there you go. You already have existing data, but it's untraceable. We cannot trace it as of the moment. So I'm just curious as how you will start collecting this data. Will this be a project that will be funded by the government? And what is the ultimate goal, immediate and ultimate goal of this data gathering for all of you?
So just to be clear, this is where we are not the ones collecting data. We're calling on the BC government to collect the data. And like you said, it's like for those of us in the community, we know through experience, we know through at least, you know, through community work that we've done, that there's a lot of people affected. But we want the government to see through this data collection how much we're affected. Good data is essentially good medicine at this point. We can't fix what we can't see, and what we're not seeing is how much we're affected, how much other communities affected. All communities are affected, and we, you know, to have proper targeted programs and policies. You can't have one blanket policy and expect it to be as successful across all communities. You know, this is again a call for the BC government to collect that data, to create those policies and programs that will support various and specific communities as needed, as required.
Part of the answer to the question is that the data needs to be collected at the various points of encounter with the medical system, right? We need to know who is getting tested, who is not getting tested, and why. We need to know who's going to the hospitals, who is being admitted, who is leaving the hospitals recovered, and who isn't, right? And in terms of the long term, right, who is seeing long-term effects in particular ways from having been infected by the, right, the COVID-19 virus, and why, right? So it's, to me, partly in those sites of encounter with the medical system that the data needs to be collected at intake.
So we're only talking about data that is available based on who was tested, who actually went to the hospital, who actually went to the clinic, but we're not gonna look for data on the, like I mentioned earlier, the untraceable ones, like those that do not go to the hospitals or the clinic, who just stay home and self-isolate for 14 days.
At this point, you know, the kinds of testing that we are doing, the kinds of data that could be available, we're not rolling out, we haven't rolled out widespread population level testing, right? And so if we do that, right, then it could be that we collect race and ethnicity data at that point as well, right? To be able to get a picture at that level. But right now we're not, there's no rolled out blanket population level testing. So yeah.
And again,
last question. Oh, sorry.
I just wanted to reiterate that it's up to the government. We as individuals and or the organizations that we're working with, we can't collect that data. I mean, we can certainly attempt to, but we can't do it at the same level and with the same level of expertise and sophistication that the BC government can. And certainly, again, this is what that call is for the government to collect that data.
Okay. And one last question for clarification. Are you doing this letter to call just the BC government, or are we talking about the federal government?
Right now, it's an immediate call to the BC government, and you know, it is a trend that we're seeing again across North America and other jurisdictions, that you know, we want to see, or we want to have this data collected so we can see public policy be informed by it. Again, to point to Toronto Public Health, where they have done this. A couple of days ago, I read that there was a councillor in Ottawa that had called for racial and ethnic data to be collected as well. And again, across the US, in various cities, we're seeing this data already being collected. It's a call to the BC government at this point, and you know, we hope that the trend catches on across the country.
For Filipino and other products from Asia, as well as fresh fruits and vegetables, poultry, meats, and seafood, come and visit 88 Supermarket with branches at 4801 Victoria Drive and its new location at 2611 East 49th Avenue in Vancouver.
Dollar Smart 99 cents App Store, located at 4811 Diesel Beach Way in Richmond. Telephone number 604-207-0072.
Sirkulo Pampangueño gumawa ng masks for fundraising. Gumawa ng masks ang Sirkulo Pampangueño upang maipamahagi ito sa mga taga-Vancouver. Ang mga masks ay project ng organisasyon upang mag-raise ng funds para ipadala sa mga nangangailangan sa Pilipinas. Isa sa mga naglungsad ng proyekto ay si Carmen na kamakailan lamang ay nawala ng kapatid dahil sa COVID-19. Ayon sa kanya, alay niya ang proyektong ito sa kanyang yumaong ate. Nakapanayam ng PNC Balitang Vancouver si Carmen tungkol sa proyekto na ito at ito ang kanyang mensahe.
Po si Carmen, kapatid ni Ate Nora Castro, namatay ng COVID-19 sa St. Paul Hospital noong April 17. Natanggap ko na po ang cremated ashes ni Ate Nora bilang alaala niya nang start kami ng project nang gumagawa ng face mask para maibahagi dito sa Canada. Ang process ay gagamitin para tumulong sa mga kababayan natin sa Pilipinas.
I wasn't able to help out my aunt in the Philippines to produce PPE. So what I'm doing is I'm trying to help them here in local anyway in Vancouver. They are in military and my aunt is serving as a president in Lions Club, so kind of inspired me to do something too while while in lockdown. My aunt is in SF, who also is a supervisor of a long-term care facility. He's actually the one who pushed me to make the mask.
I'm Star Gutierrez, an SMDC international broker in Canada and a beauty consultant, a member of Círculo Pampangueño Association of British Columbia. I'm dual citizen. That's why we're trying to raise the funding for our less fortunate kababayan. Me and my family and Auntie Carmen came up into this idea of raising funding through voluntary donation from our recipients of this face mask to help out our kababayan in the Philippines in form of relief goods such as rice, canned goods, and noodles.
I would like to thank them for their initiative of starting this project in cooperation with Círculo Pampangueño. This is a very commendable project to help out our kababayan in the Philippines. Thank you very much.
Hello everyone, this is Carreon from Tarlac City. In behalf of our kabarangay here in San Vicente, Tarlac, Philippines, we would like to extend our deep appreciation to Círculo Pampangueño of Canada, headed by Mr. Christian Tunanan and other officers and members. My sister also, Carmen Carreon, and niece Star Gutierrez, and our good heart of other kababayans in Canada.
Hello mga kabayan! Nandito po tayo ngayon. Meron po tayong special guest para sa ating show. Siyempre, kilala niyo siya. Very familiar face. 6 na taon din natin siyang nakapiling dito sa Vancouver. Siyempre, walang iba kundi si Consul General Anton Mandap. Hello po! Kumusta po?
Kumusta? Kumusta mga kababayan, mga ka-Vancouverites?
Namimiss niyo na kami?
Of course.
Kailan pa po kayo dyan? And where are you right now?
I am stationed in Melbourne, Australia. And I arrived here last December 17. So I've been here a few months.
Okay.
By the way, just a little correction. I'm not yet the Consul General. I'm still acting Consul General.
Oh, okay. So, acting Consul General of the consulate there in Melbourne since December.
since December, yes.
Oh, okay. Kumusta naman po? Ano po ang kaibahan ng Melbourne at ng Vancouver?
Many things are similar. Conveniente rin naman ng pamumuhay dito. Public transport is very convenient. In fact, I haven't found the need to buy a car yet.
Oh, wow.
Yeah, so far. But I don't know. I'm considering that. Pero like I said, things are similar. The profile of the community is similar. I think Vancouver has its advantages in certain ways, but mayroon din naman dito yung convenience ng public transport is really something. So it reminds me very much of our community also in Vancouver.
Gaano po kalaki ang Filipino community natin dyan sa Melbourne?
We have a little, it's somewhat smaller. We have about estimated among 80,000 to 100,000 Filipinos. Only in the state of Victoria. Because sakop din namin yung dalawa pang ibang states like Tasmania at saka South Australia.
Kumusta naman po ang sitwasyon dyan with this pandemic? What is the situation like in Australia?
Okay naman. I think the government, both the Commonwealth and the state governments are taking the right direction. And we have to comply. So we are on partial lockdown now. We're managing it pretty well kasi relatively mababa naman ang incidence, thankfully. And yun nga lang, certain activities have to be suspended. What are allowed are only essential activities like going to the supermarket, going to work for essential services like yung consular service namin is considered essential. And then exercise is allowed. Wag lang magtutumpok-tumpok din ng mga tao. So we maintain a proper social distancing, physical distancing. So but life goes on, and hindi naman ganun ka disruptive as far as the general population is concerned. Although there are sectors that are also suffering, lalo na yung mga international students natin. No? Marami sa kanila because they depend on their jobs to sustain themselves here, including the payment of the tuition fees, and buying food, paying for rent, etc. So marami sa kanila ang medyo nahihirapan ngayon dahil nawalan sila ng trabaho. So we're mobilizing the community to extend assistance, and also we're looking to our home office, Department of Foreign Affairs, to extend some assistance as well. So hindi pwedeng walang maapektuhan na sector kasi this is something that nobody is really prepared for, right? So tinutulungan na lang natin sa abot ng makakaya natin. Of course, meron aside from the students, may mga kababayan tayo ng mga marinero, mga seafarers na nag-stranded sa mga barko. Right? So those are some of the sectors we're looking at. Yung mga nakakababa rito to board flights, they've been able to do that. Pero karamihan sa mga seafarers have to sail home on the same vessels that they were working at. And then they are being processed there through the arrival protocols of the DOH and the Bureau of Quarantine. So meron din naman mga stranded na tourists na kailangan na umuwi pero dahil nga nag-suspend yung mga commercial flights. Luckily, nagpadala yung PAL ng Philippine Airlines ng sweeper flights. May pangalawa ng sweeper flight. I think they did the same in Vancouver. No?
Yeah.
So yung sitwasyon natin, we are still relatively in a good position in terms of managing and coping with this pandemic.
Recently po may announcements na dito sa Vancouver na there is a possibility that
some businesses, for instance, mga restaurants will slowly start opening up maybe in the next few weeks. Meron po bang similar news dyan sa Australia about opening up businesses in the next few weeks?
Yes, I think the target for things to normalize is sometime in May, middle of May. No? Pero what I can see, and I can see this firsthand dahil pumapasok naman ako sa opisina almost every day, marami na nagpupukas na shops, even electronic shops. I went to an electronic shop yesterday. I'm not trying to set an example here. It's not. But I just happened to pass by and I saw it. It was open. There were a couple of them that were open. So hindi lang essential businesses ito. Kasi kung essential ang pag-uusapan, supermarket, pharmacy, di ba? But these are ordinary retail stores. And one by one, they are starting to open.
Well, speaking of June, syempre po, malaking selebrasyon palagi pag June, pag sa ating mga Pilipino, di po ba? Dito po sa Vancouver, unfortunately, I think we will be canceling all of the activities for June. That's as an update. Yun po yata ang naging desisyon ng mga Filipino community organizations as well as the consulate. Ano po ba dyan sa Australia? Is June looking good for celebration?
Like I said, it's hard to predict. It depends also on how the host government will decide on these things. No, if they bring things back to normal, ibig sabihin papayagan na magbukas ang mga negosyo, ang mga opisina, kung ililift na yung mga lockdown restrictions and all that, we could probably be we would probably be able to celebrate as usual. But so far wala pang announcement. I have scheduled a flag raising activity sa isang public area dito. I haven't canceled it, but baka nga kailanganin gawin 'yon. Hindi lamang sa safety ng mga participants, kundi pakikiisa na rin natin sa gobyerno kasi we have to comply also with domestic or host government regulations. You know what's really working very well? Facebook and social media.
That's right.
Keeping people connected, di ba? Sabi ko kung wala ito, will probably be like yung Black Death, the pandemic during the Dark Ages when people didn't even know what was happening.
Yeah.
People were just dropping dead like flies.
Yeah.
Yeah, it's really, we're lucky. This generation is lucky. We have all of this, no? Kahit
That's
na may
true.
mga kamag-anak kaya kapilya na malalayo, we're able to check on them. Like I check on my daughter regularly and my son regularly. This is the first time nagkahiwa-hiwalay kami ng ganito eh. Unfortunately, but because of this means of communication, itong Zoom na to is really very nice, no? Like we never left each other's company.
Tama. Nung araw nga po, 'di ba, nagpapadala pa tayo ng ng tape, ng recorded message sa ating mga loved ones sa abroad.
Alala ko yun. Alala ko sa Saudi. Buwan na nga abutin bago marinig yung boses.
Oo.
Tapos by the time narinig yung boses, may nangyari na. Kung minsan nag-asawa na na.
Talaga po totoo. These are really different times, really a different phase in our lives. Pero talaga namang technology is on our side at this point in time, especially for families who are apart from each other.
That's correct. And we're making good use of it. Pag-usap, pakipagkumustahan, to entertain each other, mga TikTok, mga ganun.
Sir, maraming salamat po. Batiin niyo naman ang ating mga kababayan dito sa Vancouver.
Oo, salamat din. Kumusta sa mga kababayan natin dyan, mga kaibigan, pati mga kamag-anak na rin. Sana magkita-kita tayo ulit. I hope to be there sometime soon. for a short vacation. Kumusta rin sa mga kasama ko sa konsulado. Marami rin tayong kakilala at kaibigan dyan. So let's stay in touch. I'm really glad that we have this opportunity.
Maraming salamat.
Araw-araw, don't forget. Hindi pa tapos yung danger Mag-ingat tayo araw-araw. Stay at home as much as possible.
Maraming salamat po again, Conjen. It's really good to see you, and we wish you all the best. And we will pray for you and your family there in Melbourne.
Salamat. Keep safe, everybody. Bye.
Okay, salamat po. Nagpapasalamat po kami sa aming mga sponsors, ang 99 Cents and Up Store sa Richmond, ang Kabalan Suites Restaurant and Catering sa New Westminster, at ang 88 Supermarket na may branches sa Victoria Drive and Killarney Market. Maraming salamat po. At dito na naman nagtatapos ang aming balita para sa linggong ito. Kung kayo may mga komento, mga issue o balitang nais nyong ibahagi sa aming programa, ang PNC ay bukas para sa inyong lahat. Mag-email lamang po sa balitangvancouver@gmail.com o tumawag sa 604-588-6397. Mula po dito sa Surrey, of course, social distancing pa rin, ako po si Rosette CORREA. At ito, ang Philippine News Canada, Balitang Vancouver.
For Filipino and other products from Asia, as well as fresh fruits and vegetables, poultry, meats, and seafood, come and visit 88 Supermarket with branches at 4801 Victoria Drive and its new location at 2611 East 49th Avenue in Vancouver.
Dollar Smart 99 Cents Op Store, located at 4811 Diesel Beach Way in Richmond. Telephone number 604-207-0072.